Everyone, and thank you, uh, AIS, for inviting me here. Uh, the glory is not about the story which I'm going to tell. The glory is about that I'm here presenting in front of stalwarts like here, and especially Dr. G.N. Rao sir. Uh, I think my inspiration has been from him to do something in ophthalmology. Uh, so I'll say the story behind starts when I just finished my uh, post graduation, and when I went to uh, gathering. My father being an ophthalmologist, I was probably known as a son of Dr. J.L. Sharma, and that was a time when I thought I'll come back in this organization or with these people when I have my own name, and that was the time when I did my short-term fellowships at LV Prasad, and following that, I came back, and the thing was, I started my practice, FECO practice, way back in 1996, when very less number of people were even struggling to do FECO. So, following which I built a hospital, and it was around 100-bedded hospital, but uh, uh, IQ as such was born out of fear in 2007. Now, fear was that we were a 100-bedded hospital where ophthalmology was a part of it. It was a multi-specialty hospital in Gurgaon. You know how it is if you have been in that part of country, how developed that part of India is, and there were many such hospitals which were coming up, and I thought that we are going to lose the charm of being a 100-bed hospital. So let me do what I know the best, and the best which I knew was ophthalmology. So I thought of maybe setting up few centers, and that was the time I met my partner Rajat Goyal, who was working in Bausch& Lomb as a director, and we joined hands together, and thus on 2014, 14 January 2007, IQ was born. So IQ, what we aimed at then is the vision is to be foremost chain of eye hospitals in terms of both quality of eye care and number of patients, and to make every patient an ambassador of IQ through a combination of all these things: the highest level of quality, exceptional personal care, complete integrity to the patient and his or her needs. Now, the base I had was mainly which was transparent organization, ethical organization, professional organization. This is what I do, and this is what I tell all my doctors in the organization. So, what do we have now? Though it has been a journey from 2007, we started with the one center uh, in first center in Rewari, and then we grew slowly. But today we have 80 plus expert doctors. We have 700 plus trained staff. We have affordable world-class eye care we are giving to the patients, and we are empaneled with all TPAs, CGHS, ECHS, Ayushman, Haryana government. Now, this is why I'm saying is we don't miss on these, because we have to treat these people who are empaneled, even the Ayushman patients, where we are operating just for mere sum of 7,500 rupees. Excellence in quality, with the 21 of our hospitals are of the 39 hospitals are NMBH accredited or certified, and last 10 will be done in this year. This is our leadership team, where we have me, the CEO, the medical director for Etna, CFO, and IT head, and we are now. These are the departments for the youngers to understand why these are important. Because if you grow and build an organization which is just like a corporate, then you have to have all these departments taking care of each and everything. And this is something the organization structure is, where we have two verticals, where one is a clinical vertical headed by me, then is a operations vertical headed by Mr. Rajat Goyal. Now, this is how it is done, where you have chief medical director, then regional or medical directors, then we have a clinical in charge in all our centers who takes care of the clinical aspects of ophthalmology there. Then we have in-house consultants. Other than the clinical in charge, there will be other consultants, and they'll then OT staff and optometrist. For the CEO, he has the CFO, VPHR, AVP, purchase, IT, quality, and head of optical sales. Now, all these clubbed together form a combined approach and combined organization, which is IQ, and we aim to bring it a very clear hospital chain, which is now around 39 centers, out of which 3 are outside India. Now, we have treated 75 lakhs of patients already, and we have done more than 3 lakhs of surgeries. Now, there was a time when we were growing, and we went even up to 47 centers, but every day is not the same. We were not growing well, and there we were losing money, and because the investors and all are there, so we had to choose to close some of the hospitals. We consolidated in around 2016, and that was the time we closed 7 8 centers. So you do not shy away from that. If you have to close such centers, you've been an entrepreneur, you have to know you should not be losing money. After all, you have to earn money for yourself and for your staff, and definitely for your country. This was a time in 2017 we got an opportunity to go to Nigeria, where we started our first center in Lagos in 2017, and now we have 3 centers in Nigeria. For us, in last 4 years, we have saved around 18 million US dollars forex of Nigerian government, because the patients from there used to go outside to to maybe UK, to Dubai, and all that. And for after COVID, definitely the growth has been immense. We are growing around 75% year on year there. And this was the last center in Abuja, which was inaugurated by the president of Nigeria. Academics, scientific committee, along with fund for doctors, is a must for us. We have all talked about academics, which we have seen all the big organizations which already do academics, but it is a part of it. We organize a yearly conference by the name of Optha Quest, which is attended by more than 300, 400 doctors across India. It is not only IQ, which does it in the name of Optha Quest. And we have our own meetings, the doctor meeting, CMEs and all. And definitely fun, as probably in the session before Dr. Ramurthy said, it is very important to have fun, whether we are doctors or for the staff. The important part about all this is that we are training 150 local people are being trained in different specialties. We have optometrists being trained. We have around 60 of them on board as of now. We have PREs, which is patient relation executives, which are being trained. Then we have our center managers, which are the operation managers. We hire from the institutes directly, and we train them, and so that they become our operation managers in our different centers, which we are growing. And we do a social impact, where we are delivering inclusive world-class eye care to patients in rural and underdeveloped areas. We do around 80 to 85 camps in North India, and around 40 such camps in West, in Gujarat. And we don't shy away from treating, as I said, underprivileged patients. And we are 30% of our patients treated belong to less than 1,000 per month of income. uh, Now, for any organization, these things are very important. When you're doing a good work, you feel good when you get these awards, and definitely when you are being recognized in various either media, or whether you have your stories around, and this is something we all aspire for. So this is just what we have, and we are growing, and we want to grow further. From this year onwards, we'll be doing 5 to 6 centers every year, year on year, in this country, and around 2 centers across outside world, mainly in Africa. And thank you very much. This is our view of our first center, which we started, and that's how we have grown from there. Just 1 minute of this video, if it works. So these are our initial days, just some memories what we have from 2007, what we did, and slowly how we have grown from there. Thank you very much.